way to start the day, though, in terms of what ARKids means not only for families and their kids' health, but financially. I know, especially now, when so many families have been hurt by the recession, and what a testament to the value of this program in our state. Thank you to Kristen at first. She had to leave, but thank you to her for sharing her story. It gives a great setup for the day. We were really glad to have her here. In terms of housekeeping, quickly before I get started, Joyce Hardy isn't in here, but Joyce Hardy, any of us that have these Arkansas Advocates name tags in gold, if you need anything throughout the day, please let us know. Joyce is sort of the guru of the setup and knows everything and where everything is. She's in a bright green shirt, you can't miss her. So please get any one of us, or definitely get Joyce. I also wanted to let you know, just kind of go through your packets really quickly. A lot, or particularly what I'm going to talk about, is in much more detail in our Crossing the Finish Line report from this past year. Anything we talk about in terms of red tape cutting strategies or streamlining enrollment is in a one-pager that's behind the agenda. And then we have our summary, if you haven't seen it, of the health reform bill and the ways we think it will be good for Arkansas kids and families. We did not want to kill too many trees today, but I will tell you that we are videotaping, and we also have the PowerPoint presentations that we're going to load up onto our Summit website after today. I think the presentations should be there in the next few days, and videos hopefully in the next week or two. So we'll make sure you get that information, so don't worry, you will have access to those. We just didn't want to pile up too much paper on you today. So, with that, I'm just going to give a little overview. We're going to, we have slides. We need to re-load them. What I'm going to do, just to try to set the stage a little bit and give an overview of what's going on with kids coverage in our state. As Rich mentioned, ARKids First has been a huge success story. We continue to say that because we know it's made a difference in cutting the rate of our uninsurance among kids in more than half. But we also have some updated data on where things are today. We're not done. We're not finished with the job for kids. And we also know we've got this new set of parents and other adults that are going to be eligible in the next few years. So we want to also be thinking about what can we learn from our experience of over a decade covering kids to inform how we implement health reform moving forward. So, it's not I can look at my slides. You what? It overheated. That's not good. Okay, well I'm going to talk to my slides and then we'll jump in when it unheats. For those of you, many folks in here are members or partners with the Arkansas Finish Line Coalition, so I thank you for being here. Briefly, for those of you who aren't familiar with us, our goal, and of course we're about 3 years old, we're a reconstituted coalition of the Covering Kids and Families Coalition from years ago. Our goal is to cover every child in the state. And specifically, our specific objectives and goals have pretty much stayed the same. Of course, health reform gives us a new lens to look at everything through. But our first and second goals have always stayed the same. The first is let's get all the kids who are eligible enrolled in ARKids First. If they aren't signed up, and keep them enrolled every year. Extending health insurance to more children just over the limit for ARKids First, and I'll have some new data to show what's going on with those kids. And we know that we passed through the legislature in 2009 an expansion of ARKids from 200 to 250% of poverty. That still has yet to be implemented. We'd like to see that happen before health reform because those kids can't wait 4 years to have health coverage. And then finally, health reform. Let's look at how we expand coverage to more kids and their families and improve access to care as we implement health reform. So we want to watch what's happening and how do we make this new system work the best for kids and families in our state. So, I will say that we've had some major accomplishments, especially in 2009, that we're really proud of. The Children's Health Insurance Program was reauthorized a year before health reform. That was huge for us. It made sure we had the money to expand the program or enroll kids on CHIP, which is our ARKids First B program. We also, around actually pretty much the same month period, passed the expansion from 200 to 250. While we still have yet to implement that, that was certainly a success. We have been, over the years, we've done a great job trying to simplify the enrollment process for families for ARKids First. And last April 2009, we actually made it one way easier by eliminating the to choice between ARKids First A and B. So instead of, looking at Jody, thank you, instead of asking on the front end, do you want to have ARKids A or ARKids B, and they could, in theory, choose a program for which if they were eligible for better benefits under A, they could technically choose B. More importantly, I think it's very confusing to ask folks what they should be applying for on the front end. That was eliminated, and now families are just enrolled into whichever they're eligible for and told on the back end, what their requirements are and what their benefits are. So that to us was it sounds very simple, but a huge win in terms of making this easier for families. And then we have this new healthcare law. That's certainly a win, we hope. Not a perfect bill, not a perfect package, but we think has huge opportunity to help kids and families, particularly in our state. And then finally, I think I keep mentioning, we want to keep reiterating, ARKids First has been doing its job during this recession. Since the recession started in 2008, give or take, we've covered over 30,000 more kids on ARKids First or Medicaid. That's exactly what we're supposed to be doing for these families. And I should note, Joan's going to talk a little bit about some of this research in her presentation later, but Urban Institute last month released some new ways of looking at uninsured data. It also looked at Medicaid participation rates by state, so the number of eligible kids who are enrolled in the program. We're the 11th in the country for Medicaid and CHIP participation at 88%. I think we could get up to 95 or 100%, but we're 11th in the country, and that's good news. It's doing its job during the recession. Oh, good. Okay, so the next slide. That's the good news. But we know we still have families that are waiting on care. We're still waiting on this expansion. We have 60% of our uninsured kids who are under 200% of the poverty line. The majority of our uninsured kids in the state are already eligible and not signed up, or they get dropped off. And we know that getting an ARKids First or getting an insurance card is the first step. That gets you one step closer to care, but that doesn't necessarily mean you're going to have a regular doctor. And we need to start talking about what this means for access. They're much more likely to see a doctor or get care than if they were uninsured, but it's not necessarily a guarantee. So next slide. So this is hot off the presses because we just got these data yesterday. With the new census data for 2009, we have since '96 gotten special runs from the Annie E. Casey Foundation. So you might see reported in other places it's a little bit different. We've been getting 3-year rolling averages for over a decade now, and we think they're much more reliable for us as a small state. We also, for comparison purposes, are able to compare from 1996 when ARKids first started. But these are the numbers that we have received. In the last year, our uninsured rate among children has gone up to 10%, and it's gone up from 65,000 kids to 71,000 kids. Of those, the kids under 200 that are uninsured have stayed about the same, around 40,000 kids. So that's the good news. Our kids is doing what it's supposed to do. We're seeing more kids just over the line that are eligible for ARKids First. So that's a lot more kids, and we're moving up in the direction. You could expect this during the recession, but that's a lot more than we anticipated. And the next slide will give you a little comparison. If you look at the red line, the biggest growth in the last year in particular, but the only place it's really been growing, if you look at uninsured kids by their income level, is those kids just over the line of eligibility for ARKids First between 200 and 250% of poverty. And in the last year, it's jumped from 9,000 kids to 13,000 kids. And if you see, we've got the under 200 there. We've got the total rate, which is the blue line, I believe, and then the under 200, which is orange. Under 200 is pretty much staying the same. So those kids who have access to ARKids are pretty stable. Okay, and then from our report last year, we looked at, what's going on with case closure? We know that the enrollment, we've done a lot to improve the enrollment and the enrollment process over the years, but we still have many kids who are dropping off every year. The way you re-enroll right now, for the most part, is by getting a mailed form to your home, and you return that form to report any changes. We've done great things that John will talk about with online enrollment and Access Arkansas and changing the eligibility doorway. but we're still losing 20,000 kids a year at renewal. And if you look at, we look at why cases are closed every year, 50%, if you look at the, I think it's the green, yes, 50% or 20,000 kids, it has something to do with, it has to do with something that's not related to eligibility. They didn't return a form, they didn't give information, or they couldn't be located because their address on file might not match where they are now. So there's definitely 20,000 kids we could shore up, and obviously we know what happens when kids lose coverage, and I think Kristen talked a little bit about, they go to their appointment and they find out, oh, we have lost coverage, and hopefully someone there is helping them figure out how to re-enroll, but that's, you know, we know that's not always happening. And then finally, an ARKids First card does not necessarily guarantee that you're going to be able to see a regular doctor. It certainly gets us one step closer, but it's not a guarantee. This is from ARKids First A and B data. We looked at who had a PCP on record for ARKids First A and B. Now, that does not necessarily mean they're not seeing a regular doctor. There are a lot of reasons why that might not happen, but it's the best data we have by county and across the state on who has access to a regular doc. About 44,000 kids around the state do not have a PCP on record that are on ARKids A and B. This is sort of distribution where the darker counties, it's not just rural counties, by the way, it's a lot of more populated counties. And if you look at the next slide, those are the top 10 counties of kids who don't have an assigned PCP, and also the percentages. And I should also mention, these data that DHS gave us are from last September. We're in the process of getting new data that tries to clarify some of this as well, gives us a little more nuanced look. So we're going to be updating that as well. So this is from about a year ago. So I know they've done some things at Medicaid to raise the cap on PCP access and that kind of thing. Okay. And then there's this thing called health reform, and no one loves it or hates it completely, hopefully. I mean, I think we know that there are some real opportunities, particularly for a state like ours. And we're really excited now we can start to talk about not only those kids who need access, but their entire families, because it makes a difference when parents also have coverage for their entire family. And I think Joan's going to talk a lot about the specifics of health reform, but I think there's a lot of potential to design it in a way that's much more family and user-friendly, whether you've got Medicaid or private insurance on the exchange or other things. So, we're excited to help look at and inform and work with the state as they try to implement this new law. And our message is really, what can we learn from ARKids First? We know what has worked. We know where some gaps are for kids. There's a lot we can learn from our experience over the last decade plus with ARKids First. How can we inform this new process? And more importantly, what can we do with the kids? There are lots of things we could do now for kids that can kind of test what kinds of things need to happen for their families as we move forward. So, enrollment and renewal processes, what do those need to look like? How do we make those consistent across parents and adults and kids? We know that they're not right now. How do we make the coverage seamless and procedures consistent, whether you're getting a plan off the exchange or whether you're getting Medicaid? And of course, all of this has to do with how this benefits exchange is designed, which 2014, while a long time for kids not have coverage, is definitely not that far away. We know there's a lot of planning that's going to have to go into that. And then finally, we know because of ARKids First and Medicaid, and we have money with our children, we can start covering kids right now. So the coalition wants to see us, I've already mentioned it, implementing the expansion. There is an option to take legal immigrant kids under CHIP that you can read more about in our paper. We would love to take that option and think it only makes sense. These are kids who are barred from getting any sort of ARKids for 5 years, even if they're a legal permanent resident. There is a brief in our 2-pager behind the agenda on our strategies to improve the enrollment and renewal process, as we call it, removing red tape. And Donica Ross is going to talk a little bit about kind of the incentives that CMS has put in place through the CHIP reauthorization to help states and give states incentives to do that. And then we'd like to also do a better job of collecting better data on what kind of outreach efforts are going on in the state, how kids are getting connected to coverage, who are the organizations that are helping them, and then help inform a specific outreach plan for the state on how kids are getting enrolled. And then finally, this is the one that doesn't have a lot of detail, because I think we know we're not going to be able to do this alone as ARKids Advocates or the Finish Line Coalition. How do we get, I think it's both attracting more professionals to the field, but also making sure more kids have access to the care that they need once they have access to health insurance. And I think that's going to be something we're going to be grappling with a lot as we implement health reform in the state as well. I think I'm right on time.